I just want to run through setting up the Fresenius 5008 machine, getting ready for a patient treatment, and also taking the patient off. All right, so first we want to start with bringing our patient in, getting their weight, making sure we have the right patient to begin with. We also want to go through the orders, making sure that we check the orders on NephroCare and the bedside. You can see the orders from there. You can also see the orders on the R191 print off for the worksheet. Hopefully the two match. The other thing, you need to make sure that all your screens match your dialysis order. So you would start by making sure that your machine was cleaned recently. You would go to cleaning status. It shows you the last 2 times it was cleaned. So I can see this machine had a cold disinfection last night. And so this morning I did the chlorine test strip to make sure that it was ready for use. So usually we're rinsing in between every patient, and every other night, then the once a week bleach disinfection, we do the heat disinfection. So that's our routine, unless of course the patient is hepatitis B or HIV positive, then we're doing heat disinfection after each treatment. All right, so the other thing I need to do, this is my setup screen, so it can kind of help you with setting up all your tubing. There's also a Fresenius manual that can help you with setting up the tubing. Preparation screens, so I'm going to be setting my UF goal according to my dry weight. So I'm taking my weight coming in, minusing my dry weight, adding on the rinse and prime, which is about 400 mils, give or take, and then also any drinks the patient's consuming or any IV medications that I might be administering, that's going to be added on to my goal. And of course, the nurse has to make a decision based on the patient's status, any current trends, whether or not they feel it's safe to use the goal. Then we have to make sure our UF time matches our dialysis orders. We have to check prescribed sodium, prescribed bicarbonate, what kind of dialyzer we're using. So this one here would be the FX 800 HDF. Then we keep moving along. We check our bath, our acid bath. Also, this repeats sodium bicarb. Your auto flow, this is all about your dialysate flow. So the 1.8 auto flow being on, this is kind of the standard order unless otherwise specified. 36.5 dialysate temperature, your flow is on. UF menu, so this is a lot of repeat, but here you have the option to choose a UF profile if you choose. Blood volume monitor, I can see that it's calibrated and ready to go. I can see by the green cup being up. If it had just a line, that would mean that my blood volume monitor isn't calibrated, so then I would want to double check this little door down here to make sure that it's set properly and clean, because if it's not clean inside, it may not calibrate. So sometimes what you can do is take an alcohol swab, take the line out, clean inside, let it dry, put the line back in, close the door, and it would take another few minutes before it can calibrate, or at least see if it's going to calibrate on your machine. Okay. Blood temperature monitoring. So we don't use this in our unit. Our nephrologist hasn't chosen to use the temperature control, but we do want the recirculation test to go on once our treatment started. And once it's run for the first half hour, it's going to do a recirculation percentage. All right. Online clearance module. So our goal K2/V is always 1.4. We always have to check, make sure that the patient's volume for urea is going to be entered into the machine, and that's how the machine calculates the patient's K2/V, or it uses it to calculate. So system screen, if you want to put any reminders in, this can give you a little alarm partway through. Double check your heparin, bolus, and duration, that it's appropriate according to the orders. So stop time is typically 1 hour before the end for fistulas and 0 stop time for central venous catheters. We need to double check our alarm limits are set on the machine to make sure they're within reasonable parameters. And usually our blood pressure is going to go off every 30 minutes or more often for some patients if necessary, or the absolute minimum is once an hour. Blood volume monitoring. So we don't use UF control, but we can set a critical RBV percentage, and then it gives us a graph, and that's going to be the critical RBV value on our graph. And the online clearance module, that repeats itself. All right, so I'm doing a set of vitals on my patient, and also kind of refer back to the video about Scrub the Health video to give you a little bit more detail, because I'm going to kind of go through this really quick. So patient has a mask. I'm going to put my mask on. I'm going going to do a hand spritz. I'm going to put on my non-sterile gloves. Okay, so I make sure my pump is stopped before I get started. I'm going to do 6 clamps closed, so 1, 2, 3, 4, 5, 6, 2 on the saline line. That's also when I do my alcohol scrub of my lines here. So I'm scrubbing up and down, letting that air dry. Okay, I get another 4x4, fresh one, put it under the patient. Do my outer scrub the hub on the outsides of the caps and all around the clamps. Okay, then I discard my non-sterile gloves, do another hand spritz, let my hands dry. I put on 1 sterile glove, of course. I'm just gonna run through this quick. 1 sterile glove. I'm gonna pull out my swabs. Use my sterile gloved hand to pull out my sterile towel. Put it underneath the lines. And remove the 4x4. Put on my other sterile glove. Then I'm going to do scrub the hub with the cap off, just on the end of the catheter, 30 seconds. Do my 5 mil waste. My 5 times back and forth, pause, start, pause, start, stop, I should say. Then I'm going to do my normal saline, flush, leave the syringe hanging. Second, scrub the hub on the other side. 5 mil discard. Flush with the empty syringe, back and forth, 5 times. Leave it hanging. I'm going to grab 1 blood line, attach, do a little gentle tug to make sure it's attached properly. Second blood line, attach to the patient, small tug. I unclamp, 1, 2, 3, 4 clamps. Then I'm going to start my pump. So it should be at 150 mils per minute at the time that I start my pump. Then I'm going to gradually bring my pump speed up. So I'll bring it up to about 200. Then I'm going to administer my heparin bolus. And so I choose my heparin bolus. At that point, I'm going to keep bringing my pump speed up. The machine's going to tell me when it's ready to start the treatment, and then I say, okay. I'm going to do another set of vital signs once I've got the blood through the lines. Continue to bring my blood pump up to maximize my arterial and venous pressure. The faster your pump speed, generally speaking, the greater your KT over V is, which is a matter of cleaning. So absolute max would be negative 250 or positive 250 for venous. Usually we recommend negative 220 or positive 220, and whatever is your limiting factor, that's going to decide what your blood pump speed is. So if your blood pump speed is less than 200 mils per minute, you're going to be at risk for clotting up your lines. You're also not going to have a very good cleaning during your treatment, so that's when it's necessary to consult the nephrologist to figure out how can we get the pump speed up, whether or not you need to use some alteplase or whatever. All right. The other thing that I wanted just to quickly review is that when you are loading your heparin syringe, which you're doing it before you start your treatment, there are 4 checks. So the first check is to make sure that you're tight here. Second check is to make sure that you are in between the two. You push down to make sure that you're not below the metal bar here. Third check, you bring this up, give a gentle tug to make sure it's attached to the bottom of the syringe. Fourth thing before you close the door is you unclamp your syringe. So there's your 4 checks for your heparin. All right, so end of treatment. The machine tells you that it's done the treatment, or you could choose reinfusion before you're finished, and then that will start the reinfusion. Once you're on your reinfusion screen, which is not allowing me to select, you have to turn the reinfusion on. At that point, it asks you if you're connected to your normal saline. So at this point, this is where you would open up your 2 normal saline clamps, open, then you would clamp your arterial clamp. The machine automatically goes to 150 mils per minute and has a set return volume. So once it senses it's starting to clear here in the sensor, it's going to ask you if you want to continue treatment or remove blood lines. So at that point, if I feel that or continue reinfusion. So if I doesn't look like watermelon color, then I'm going to say continue. And then once it looks watermelon kind of dilution, then I'm going to stop my pump. I'm going to clamp my blue, unclamp my red, and the rest is returned by gravity. So once again, I'm watching closely for when it becomes like a watermelon kind of dilution. Then I'm going to clamp my red, do one final blood pressure. Generally speaking, according to what is appropriate for the patient, we generally say systolic of at least 100. And if not, especially if the patient's symptomatic, we just keep the lines attached in case we need to do normal saline bolus. So once we're happy that the final blood pressure is stable, then we're going to go ahead with our off procedure and then of course disconnect. So we do the same outer scrub, still connected, and then we do the inner scrub, the hub, flush, and then sodium citrate with the 0.1 ml overfill at the end. And then of course a fresh set of blue caps. So hopefully that clears things up and kind of gives everyone a brief summary of the on-off, being prepared, and then of course how to make sure that your machine is ready to go. All right.